Hello, everybody, and welcome to this week's Spinal Workshop. Before we get into it, my name is Dr. Jake Helms with Apex Spine and Performance. As we always like to start out these videos, education is one of the most important things that we feel like we can do for our community, and the more people are educated, the better choices they make and the healthier outcomes that they get. After all, doctor means teacher. And if I'm not teaching you anything, I'm not living up to that title. So, as you know, we like to do these spinal workshops every single week. And this week, we are jumping into osteoporosis. Now, I know this is a very common thing that comes up in the office. Something we're going to just dive into just a little bit. I know you can go really deep and every case is individualized. So we're going to start at a pretty surface level, but basically just kind of understand what is osteoporosis and some details on how we can prevent it, maybe reverse it, different things that can help optimize our health. Before we get into that important information, make sure you like the video. If you learned something, share it. Make sure to leave a comment. Let us know what you think. Let us know how maybe your conditions have been impacted, osteoporosis, or maybe people that you know have seen results and success stories with osteoporosis. We definitely want to hear from you as well. So let's jump into it. So osteoporosis, it's a very common thing. And we'll get into how common here in just a second. But really, osteoporosis is when the bones weaken, lose their density and strength beyond a certain point. And why I say beyond a certain point is because a lot of people, you need to hit a certain threshold for it to be classified as osteoporosis. There's an intermediate condition known as osteopenia, where that bone density is decreased, but maybe not to that certain level. But we'll get into the details and semantics of that in a minute. Osteoporosis, most commonly seen in women. 25%, 1 in 4 in a room of women over 50 will have osteoporosis. 33% of all people have osteopenia, which is, like I said, is almost, you can think about it as that pre-stage osteoporosis. In many cases, osteopenia is a precursor and eventually leads to osteoporosis as an official diagnosis. And that's where that bone density has decreased. Biggest things that usually come up with someone who has osteoporosis, different areas of concern. Mostly comes down to bone fractures. Anytime you're talking about the decreased strength in the bone, obviously you're at a risk of fractures. Most commonly, people always talk about broken hip. Typically you see with older women is the most prevalent cause of a broken hip, typically from a fall of some kind. But also you can see this condition very commonly, and myself being a chiropractor, in the spine. Again, as that bone decreases, we put impacts on our spine that can lead to different compression fractures of that spine, where sometimes we can find it almost incidentally in our office, which is one of the reasons why some of that imaging is so important. You can also see that commonly with the wrists. Again, when you lose that bone density, any sort of fall, typically a fall, you try to catch yourself. When you try to catch yourself, you put extra impact on your hands and wrist, and that can also increase the likelihood of fracture. So what is actually happening? Why is it so much of women over 50? What's that magic number that usually turns things over? Typically has to do a lot with postmenopausal women. Here's what happens. Is decrease in estrogen after menopausal age with women is typically a big driver when it comes to that bone density, bone strength. So estrogen helps contribute the uptake in calcium reabsorption into the bone. Obviously now you lose that estrogen levels within the body, and it's going to impact how much calcium also goes into the bone. You're not going to have that reabsorption. So typically when we talk about bones, everyone loves to talk about calcium. And there's a reason why, is because calcium is a very big driver in the makeup of our bone structure. Even from a young age. I know I was told this, I don't know if you were, Drink your milk, you'll get strong bones. Why? Milk is a very good source of calcium. So especially when we are growing, as we are going through childhood, adolescence, and eventually into adulthood when our bones become more solid, is that calcium is important. 100%. You need the building blocks to build up that bone strength. There's also a phosphate component within our bone structure, but the big driver is calcium. So why does calcium decrease? Right? We need our bones. We're alive. We're putting impact on our bodies. Why is calcium leaving the bone? Once it's there, shouldn't it stay? Well, our body's in constant flux all the time with different chemicals throughout the body. The easiest one to think of is water. Water is going in and out of our tissues all day long. Calcium's no different there. So calcium has more functions within the body than just bone structure. Our muscles and our nerves require calcium to function properly. And so at that point, once we don't have enough calcium in our blood in an active form, mostly that we do not get enough in our diet, those muscles and nerves still need to function. And so what happens is when we need calcium to make sure our muscles and nerves function the way that they should, we're going to have to pull it from somewhere. And a vast majority, in fact about 99% of our calcium is stored in our bones and teeth. And so when we need calcium, there's an easy place to go to, and it's our bones. So what happens is the body starts to pull calcium from that bone to modify and make sure that the body is functioning in other more urgent ways, if you will. So, I kind of alluded to it just a minute ago. The biggest thing is we do not get sufficient enough calcium within our diet. I know a big driver of how to get that in our diet, and we'll get that in a minute, is dairy products. There's a reason why as a kid we're typically told to drink more milk is because we need more milk as our bones are growing. Even from infant, the first food we have is milk. And so we're constantly increasing that calcium and having it being a very large portion of our diet from a very young age. But as we age, and I talked a little bit about the estrogen and hormone levels, as those adapt as well, this is still common. I mean, it's still prevalent in men. Men can get osteoporosis, but it's more prevalent in women. Is our bone structures just lose it. We're not getting that same sort of calcium in our diet. I know dairy products are a big driver. Broccoli, spinach, other dark greens, almonds, certain nuts have also a very good source of calcium. Most commonly, and this has become more, I would say, regular practice amongst primary care providers that I have seen, is recommending a calcium supplement to all women going through menopause or postmenopausal. Why? Is because they want that calcium available in the body. If the body does not have calcium, it's going to pull it. If it has calcium running through our system, running through our bloodstream, readily available, it does not need to draw as much calcium from the bones, which then allows the bones to hang on to the calcium, increasing the strength. It's a very common practice now that is used to basically slow the processes of pulling away with our bones there. Typically, is I hear a lot of vitamin D and calcium going hand in hand with that. Vitamin D also helps with that absorption within that calcium into the bones there. But one of the biggest pieces that I find missing from when I ever have the osteoporosis conversation. When calcium is in the bloodstream, it is readily available. I love that. That means you're not going to draw from the bones. But that does not mean that even for my osteopenia patients, osteoporosis, is that we still have not enough calcium within the bones. So how do we strengthen our bones? One, we need the building blocks. So that's your calcium, your vitamin D, phosphorus, different materials, chemicals that we have within our body. Again, most of them you can get within your diet, just basic nutrients that we need to live. We also need to provide a stress to the bone, which requires the bone to have strength. Now, we do this in a very smart way, and the easiest way to do that is various resistance trainings and exercise. I think a lot of people know that, if you break a bone, it grows back stronger in that area because the bone has been under stress. It knows it needs more strength in that specific area. When we stress our body, when we do various resistance trainings, and when I say resistance training and exercise, it can be even one of the simplest things that I like in terms of an exercise, and I've talked about it many times on these spinal workshops, walking. Walking is a great activity. What it's doing is it's providing a low force impact in your bones, specifically with walking your lower extremities, but it can even be pushed out to push-ups, different band exercises, yoga. Anything that's stressing that bone and putting extra weight on that bone will cause more stress, which provokes calcium to go into the bone to provide that strength there. But that is the big missing ingredient that I hear from a lot of patients is I'm taking my calcium, I'm taking my vitamin D, and I'm still having decreased bone density. We're missing that part. There needs to be a reason for that calcium to not just slow the draw from our bones. There needs to be a reason for calcium to go into the bones to actually help build that strength, and that is the biggest thing. But another thing is, and I mentioned it earlier, with spinal fractures is a common problem in a way that you find out that, we have decreased bone loss. Like I said, sometimes it can be incidental that we find that, and we break the news to patients, hey, you have a compression fracture here that you didn't even know about, is getting your spine checked. Again, there are various imaging, just monitoring yourself, checking in on that bone density. Now, we can't diagnose from an x-ray if we were to take one. We would need a special scan to give you an osteoporosis diagnosis. That is called a DEXA scan. But what you can do is you can see where there may be issues. You may be encouraged at that point to how do we build an exercise routine? How do we get more nutrients within our diet that allows us to slow or even reverse some of those osteoporotic or osteopenia conditions? Again, building bone strength allows our body to function the way that it should. In taking care of ourselves, whether it's through chiropractic or other means, obviously, I see the extreme value in chiropractic and getting your spine check allows us to monitor these things, allows us to walk alongside, allows us to help encourage you making healthier decisions and allow your body to function at the best way that it can. So, hope that shed some light, hope that answered some questions that some of you may have had on osteoporosis, osteopenia. Like I said before, if you like the video, make sure you like it, subscribe to our channel. That allows you to never miss a video. And make sure you share it to someone if you learned something. Please let us know what you think, and then we will look forward to seeing you at our next spinal workshop.
Hey everybody, hope you enjoyed that spinal workshop. Don't forget to like the video and feel free to share it if you learned something. Be sure to subscribe to our channel so you have quick access to our videos, and also don't forget to hit that notification bell so you are alerted every time that we post a video. You can also check out other spinal workshops by clicking right over here. Until next time, make sure you live your best life, and we'll look forward to seeing you at that workshop.